Welcome to the Thinking Practitioner podcast,
a podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Dale Healey.
Welcome to the Thinking Practitioner. The Thinking Practitioner podcast is proudly supported by ABMP, the Associated Bodywork and Massage Professionals, the premier association for dedicated massage and bodywork practitioners like you. When you join ABMP, you're not just getting industry-leading liability insurance, you're gaining practical resources designed to support your career, from free top-tier continuing education and quick reference apps like Pocket Pathology and 5-Minute Muscles. ABMP also equips you with the tools you need to succeed and grow your practice. ABMP is committed to elevating the profession with expert voices, fresh perspectives, and invaluable insights through CE courses, the ABMP podcast, and Massage and Bodywork magazine, featuring some industry leaders like Dale Healey, my partner, and myself, Whitney Lowe. The Thinking Practitioner listeners can also get exclusive savings on ABMP membership at abmp.com/thinking. So join the best and expect more from your massage association. Welcome, everyone, to the Thinking Practitioner. I'm here today with one of my colleagues, Dale Healey. Till is off this week. Dale, thank you so much for joining us. Dale is an associate faculty member at Northwestern Health Sciences University, also currently chair of the Commission on Massage Therapy Accreditation, and also chair of the Academic Collaborative for Integrative Health. We have a lot of acronyms we're going to be getting into today. So, Dale, welcome to the Thinking Practitioner. Great to have you here.
Thank you so much. Great to be here. Great to join you, and good to see you again.
Yes, indeed. So I was trying to remember and think back when we first met and how long we've known each other. I know it's been probably at least 2 decades or so, or since the early 2000s, maybe, something like that.
I would imagine. That's a good question. I joined Northwestern Health Sciences University in 2002.
Yeah.
So unlikely it was before that, although I was involved in massage therapy before that for about 5 years at another institution, but I really didn't get involved on with some of the outside organizations and such until I came to Northwestern in 2002. I know we had you over to Northwestern a couple of times, at least for our symposium, but I feel like we met before that.
Yeah.
At conferences and such, yeah.
Yeah, well, anyway, always great to spend time with you and have interesting discussions with you. So we're going to be doing some deep dives today into some aspects of massage in the integrative health world, which you have been deeply enmeshed in. And I want to, if you will, just take a moment to let everybody know a little bit more about your extremely extensive background in some of these areas and what you're currently doing as well.
All right, I'll do it. Thanks. So yeah, I'm trained as a chiropractor originally. If we go back to that, I went into chiropractic school. Not at Northwestern Health Sciences University. I went to chiropractic school in Dallas, Texas. I think I ended up in Dallas in part because I'm Canadian from Edmonton, Alberta. And so heading out of cold Edmonton, Alberta and spending some time in Dallas was a little bit appealing to me, I think. So,
all right.
So when I got out of chiropractic school, I kind of stumbled into a teaching position at a small massage therapy school outside of Salt Lake City, Utah. And I started as a part-time instructor, and within not too long, within a year, I think, they gave me the opportunity to become the education director for the institution. And during that time, I was kind of figuring out what I wanted to do as a chiropractor. But in parallel, I was learning that I really loved massage therapy, and I really loved teaching massage therapy, and I loved the administrative part. And so I spent 5 years at that school, at Myotherapy College of Utah, it was called at the time. I think they may have changed their name since then, actually. But then in 2002, I found my way to Northwestern Health Sciences University. That position was appealing to me because they had just started a new massage therapy school, and I was going there to be the administrator over that massage therapy school. But they also had chiropractic, acupuncture, some undergraduate programming. And so, this is the theme of our discussion, right? Is integrative care. So the opportunity to be in an institution that brought all of these professions together on the education side was appealing to me, being able to work with that. I was focused on massage therapy, but we had all these other professions in there. And I didn't really know it at the time, but Minneapolis, St. Paul area is a real hotbed for integrative approaches to care. So the University of Minnesota, the Mayo Clinic, Abbott Northwestern Hospital, all of these institutions are really, really involved in integrative care. So it turned out to be a great move for me in terms of getting involved in that world. So I came to Northwestern. One of my first jobs that they gave me, first task to complete, was to get the program CompTIA accredited. That was important to them. So I learned about Commission on Massage Therapy accreditation, CompTIA. I became a site team visitor, going out to schools, both to, it was an interesting thing for me to do, to travel around the country and visit these schools, but it was also a way to learn about CompTIA, learn about different educational models and massage therapy that were out there. And so over this time, my knowledge of massage therapy from an administrative point of view, at least, grew. My knowledge of CompTIA. That's kind of how, I learned more and more about integrative care.
Yeah.
And then jumping ahead a little bit, I've been involved in CompTIA ever since. But so that exposure to CompTIA and my involvement at Northwestern, both of those organizations have connections to what was then ACAC, the Academic Consortium for Complementary and Alternative Health. And I can talk a little bit more about the evolution of how ACAC became, what it is today. But that's, I guess, the short version of how I kind of stumbled into this. So I'm a chiropractor by training, and I've overseen, massage therapy programs and other programs at Northwestern. But really, massage therapy is kind of my first love, I guess you might say. That's where this all started for me. I mean, chiropractic for sure, but really, massage therapy has defined my career much more than chiropractic, I guess.
So, and we're going to get into this in a bit more detail, but for those who may not be as familiar with the term or the concept, can you kind of give us a sort of an overall view of what integrative healthcare or integrative care is? What does that mean?
Sure, sure. So, integrative care is a term that was sort of um, it seems like a simple term, but it has a lot of different interpretations and meanings attached to it. So, uh, integrative care, I guess I'll start with my understanding or my definition of where we are now with integrative care. Integrative care involves bringing the the best practitioners, the best individuals with the best experience, the most applicable experience, together in the care of a patient. One important element of integrative care is a term called whole health or whole person care. So it's addressing the whole person, not just the disease, but all the elements that feed into that contribute to a person's health and maybe their absence of health as well. So integrative care is not unique to what we used to call alternative care practitioners. It's not a term that chiropractors, acupuncturists, and massage own. It's everybody, right? It's the conventional healthcare practitioners. It's the complementary healthcare practitioners, all coming together, working in the best interest of the patient at the tops of their scope of practice. So I guess that's how I would define it. That'll become more clear, I think, as we talk about the different initiatives and such that are involved in an integrative approach to care and health.
Yeah. You and I worked together on ACAC years ago. This was in the early 2010s, I guess was when this was, if I can kind of remember. And one of the things that was really sort of inspirational for me in being involved with that organization, what was happening was seeing the opening of discussion amongst practitioners of learning about what each of us do. Because as we talked about in the healthcare system, we exist in these silos where we don't get a lot of communication with other health professionals. And so, how has that kind of grown since that time? Do you feel like we've been making some significant headway with that whole process of what we call
Yeah.
interprofessional education or learning more about each other?
Yeah, I'm glad you said that because I'm glad you framed it up that way because that's exactly what was originally ACAC and now is ACIH and now under the AIHM umbrella, which we can talk more about. But learning more about each other is so critical in what we bring to the table because, you go through chiropractic school, you go through massage school, you go through medical school, you get your focus kind of comes down into what you do. You're a specialist in that area. And what's the saying? If all when you got a hammer, everything looks like a nail, right?
Yeah.
Um, you know, myself, I'm trained as a chiropractor, but I taught for many years in massage therapy and been exposed to what massage therapy can do. So when I came to Northwestern, I remember having conversations with the chiropractors there and about massage therapy and having conversations with the massage therapists about chiropractors and coming away with this feeling of,
Yeah.
oh my gosh, the chiropractors have no idea what
Yeah.
the massage therapists can do,
Yeah.
what they bring to the table. And then I would similarly, after I talked to the massage therapist, I'd say, oh my gosh, the massage therapists have no idea what chiropractors can do or what
Yeah.
they're focused on. And so that gap leads to all sorts of challenges when we're trying to operate in teams. So
Yeah.
educating and having conversations with each other and exposing each other to what we do is so critical. So when it comes to what is now ACIH and AIHM, yes, that is a big focus of what we try and do, and try and have these conversations. As a matter of fact, just this morning, I had a we had a ACIH meeting with the members of ACIH, and so we came together and are talking with each other about initiatives that we're all focused on and such. And so some of the things that we are engaged in. So you may be familiar. I don't know if you remember when we published the CEDR,
Oh yeah.
the Clinician and Educator's Desk Reference, and
Yep.
we're starting to work on the next edition of that. So the purpose of that book is to highlight, from a pretty high level, what a massage therapist does, what the education level is, what the areas of focus are, what conditions they treat. Same for chiropractors, naturopathic physicians, acupuncturists, and herbal medicine practitioners. So there's also a course in development through ACIH that is designed to educate anybody that takes the course on what these different practitioners do.
Mhm.
I when I got my PhD about 10 years ago, my dissertation was focused on experience, expectations, and plans of incoming medical students when it comes to complementary and integrative health. So have they gotten a massage? Do they get acupuncture treatments? Have they seen a chiropractor? What are their expectations in medical school to be exposed to more of that? And then what are their plans when they get out to practice to work with a chiropractor, a massage therapist, or an acupuncturist, et cetera? And not surprisingly, probably, but the more experience they had, exposure they had to those practices, the more likely they were to expect more of it, and the more likely they were to plan on working with them when they got out into practice. And that's been kind of our approach at Northwestern Health Sciences University, is to try and create opportunities for exposure. And it
Yeah.
doesn't take much. It
Mhm.
doesn't take much. So, if you get a massage, go see a chiropractor, learn about what an acupuncturist does. Um, Small pieces of exposure, and I can give you some more examples of how we do that if we want to get into that, but that can make a world of difference in how people practice out in the real world and how open they are to referring to an acupuncturist or working with a massage therapist for the betterment of the patient. So,
Yeah, we had a meeting, and I'm sure you will remember this back in, oh gosh, I don't even remember when this was, maybe, 2011, 2012 or something like that. That was at, I believe it was at George Washington University. Do you remember what the name of that gathering was? Because this was again with a lot of these other people that you're talking about in these other health professions, but also gathering together with medical school educators to
yes.
talk about this kind of stuff. It was super inspiring.
Yes.
Um,
So I think that was a meeting with the consortium of, um, oh boy, I don't know that I'm going to be able to come up with the name of their full conference, but it's a the consortium that hosted, I believe they hosted that meeting. It's a consortium of academic health centers and medical schools that are committed to complementary and integrative approaches to health. So in order for, I think there's maybe 75 or so members of that consortium now that are committed to these principles and offer some education, at least some education to their medical students about complementary and integrative health. So, yeah, that was a good one. And there's been, a number of those conferences over the years that are pretty inspirational and exciting to see where some of this is going.
Yeah. Do you know if any of this is changing in medical schools in terms of like having coursework or exposure to some of these other ideas and things that are, different kinds of practices than what we would consider sort of traditional medical care or healthcare things? Do you know if that's increasing at all at this stage?
Yes. If that consortium, if they're any indication of this, I know that, they started out with half a dozen members and ramped up to, I think, like I say, about 75 or 80 members now. And, you know, I know they all offer something. So an example, University of Minnesota and Mary Jo Kreitzer at the University of Minnesota are all in on this, right? So we would, so just an example of how they're doing it at University of Minnesota, they would bring their second year medical students out to Northwestern, and we would have a morning with them to expose them to acupuncture specifically. We had a earlier version of it, had it with broader exposing them to chiropractic, acupuncture, massage therapy, other manual therapies, but they had some budget cuts and had to cut it down. And so we focused on acupuncture. So they haul all their second year medical students, 100 or so of them, out to Northwestern. And we've got just a couple hours with them to talk to them about acupuncture, to bring them into the gym and experience moxibustion and see what it feels like to have an acupuncture needle inserted, that sort of thing. And we do a pre and post assessment with them. And it is, as I was saying earlier, it doesn't take much. I mean, that little exposure gives those future physicians enough to be able to say, when a patient comes in and says, yes, I've been to an acupuncturist. I went to an acupuncturist. What do you think about that? A little light is going to go off in their head and say, yeah, I remember going out to Northwestern and that was a positive experience and might be worth looking into. It doesn't mean that they know everything about acupuncture, but just enough exposure to be able to have that conversation, and it's not some foreign, crazy thing.
Yeah. So let me flip the question a little bit now and ask you, like, what's your take on how we're doing in the other direction in terms of massage therapy education, getting a little bit better awareness of what's going on in some of the other aspects of the healthcare system? Because I know, at least when I went to massage therapy school back in the 1980s, there was a kind of pervasive underlying tone of the big bad medical establishment is doing it all wrong, and so we're going to save the world kind of thing. And I know that's tempered down a little bit, but I do think, I personally do think we have a long way to go to really get a lot of massage therapists to understand what goes on in the healthcare system a little more thoroughly. So what is your take?
I would agree with that. And I come from, talking about professions that, refer to the, conventional medicine as the bad guys. I come from chiropractic. I mean, that's that happened a lot. Certainly, I heard a lot of that when I was in chiropractic school. That, in my experience, that has changed significantly. Now, there's a difference between not calling them the bad guy anymore and, fully, recognizing that they've got a legitimate role to play. And in healthcare, I think we have some more work to do there. But I think the stage is well set for that. Now, the other thing I need to remember is, these circles I run in and these boards that I'm on, that's all we talk about, right? Is how wonderful things are. And, we're all working together, and at these conferences, we're all preaching to the choir, because the people that show up at those conferences are the ones that are all in on the teamwork and such. So I do, there's a long way to go on both sides, but the opportunity is so exciting. I mean, especially for massage therapy, I think there's just, there's just such a tremendous opportunity for massage therapists to participate in a meaningful way in not just, you know, not just participate as individuals, and that's a wonderful thing in and of itself, but to make a real difference in outcomes for patients. And I think that's what excites me about massage therapy is, you know, the just the potential there. And it's frustrating too at the same time because you see it and it's like, oh,
Yeah.
why can't we leap forward in
Right.
some of this
Yeah.
stuff, you know?
Yeah.
I a quick story. I One of our graduates from several years ago, he got a position in a hospital in Minneapolis, and he tells a story of being called down to the emergency room and asked to work on a woman who was I think uh, was a regular at the emergency room looking for pain medication, and
Mm.
they were struggling with how to deal with that with their multiple visits to the ER. So they called this massage therapist and said, "Would you mind, working with Mrs. Jones and seeing what you can do?" And so he went down and worked on her for a while, gave her a nice, relaxing massage. I don't know exactly what he did, I guess, but that was the end of it. He went back to his shift, and then a little while later, he got called by the head nurse or whoever had summoned him to go down there, and she said, "What did you do with Mrs. Jones?" And he got a little bit nervous, like, "Oh no, did she complain or what's wrong?" She said, she left without wanting her medication. She skipped it. And
Mm.
he was like, "Wow, that's
Yeah.
look what can happen." Now, is that going to happen every single time? Of course not. Of
Yeah.
course not. I mean, there's a lot of folks that come into the emergency room that absolutely need pain medication. They absolutely need advanced care. But there's a significant portion, a percentage that come in that, you know, if we had a massage therapist there, what kind of a difference could that make in the
Yeah.
opioid crisis?
Mhm.
I mean, if that was 1%, that would be billions of
Yeah.
dollars
Yeah.
of
Yeah.
savings to,
Huge.
yeah. So that's just, I mean, that's one little case study, but, you multiply that by, 100,000, a million,
Yeah.
whatever, and it's
It
huge.
is big. Yeah. So I want to backtrack for a minute. We've said a couple things about AIHM and
Yeah.
ACIH. I want to see if you can just take a moment, tell us a little bit about those organizations or the umbrella organization of AIHM, and what are these organizations, and why massage therapists should care about this.
All right. So, back in the mid to late 70s, there was a group of holistic medical doctors that came together that embraced some of these principles that we've been talking about. So a holistic approach, caring for the whole patient, incorporation of things like meditation and herbalism and those sorts of things. That group was kind of the root. That's the origin of what is today the Academy of Integrative Health and Medicine. So we can think of it that way.
Okay.
There's been a few versions of those organizations, I guess, that has evolved over the years, but they've kind of come to present day as the Academy of Integrative Health and Medicine. That group, up until relatively recently, and I'll talk about that, was made up of mainly individual practitioners as members from the conventional medicine side. So medical doctors, nurses, physical therapists, pharmacists, that sort of thing, who have an interest in whole person care, integrative care, incorporating acupuncture, chiropractic, massage therapy. About 4 years ago, the group that we had reference to ACAC, you mentioned, right? The Academic Consortium for Complementary and Alternative Healthcare. That group is made up primarily of organizations from the complementary side, an integrative medicine side of the equation. So chiropractic organizations, massage therapy organizations, acupuncture organizations, naturopathic physician organizations, yoga therapists, those sorts of things. So the regulatory agencies came together in this umbrella, which was ACAC, to advance principles of whole person care and integrative approaches to care. About, let's see, several years ago, ACAC changed its name to ACIH. So the Academic Collaborative for Integrative Health. So ACAC became ACIH. And a few years after changing their name to ACIH, in 2021, they merged with AIHM. So on the one side, we have AIHM, which is individual, let's call them medical practitioners who are interested in reaching out to the complementary and integrative care folks. And we have ACIH, which is groups or organizations that are from the complementary and integrative health world that are sort of reaching out to conventional medicine. So we got individuals and groups, conventional and complementary, coming together in what is now the current version of AIHM that has organizational members that has broadened since that point. So that includes now some schools, the functional medicine folks, I Am For Us, several massage therapy organizations. So COMPTA, the National Certification Board for Therapeutic Massage and Bodywork, the Alliance for Massage Therapy Education is a member. So all of these, and then the individual member side has also broadened to include more chiropractors, acupuncturists, massage therapists. So it really is a big umbrella now, I guess, is the bottom line that I want to highlight on that point. So
Yeah. So I've spoken on our podcast a number of different times of sort of this challenge we have in the world of massage therapy education of being this kind of split personality between the massage as a sort of personal wellness service versus massage as a healthcare service. And what's your take on like where we are now with this sort of idea of massage getting more accepted into integrative healthcare settings, when we still have some significant, at least in my opinion, educational deficiencies in training massage therapists to work in these environments?
Oh gosh, this is one of my favorite topics to talk about is this division in massage therapy that is and I come at it in a lot of different ways. So oftentimes when I talk to prospective students, when I'm encouraging them to consider a career in massage therapy, I say, massage therapy is healthcare. And it has, such amazing health benefits, and it's accepted in so many different environments. So you would be no more surprised to see a massage therapist on the beach in Mexico, right? As you would to see a massage therapist in the hospital, right? I mean, they are in all of these settings. And in my opinion, the health benefits are there wherever your environment is. You can't say it's tough to say, well, now I'm in a hospital, so I'm a healthcare provider and there's going to be health benefits. Now I'm on the beach, so doing the same type of massage perhaps, and those health benefits aren't there anymore. I mean, this is the wonderful thing. This is the blessing and challenge of massage therapy, I think, because it leads to these sort of debates about, well, what are we? We have this identity crisis. Are we healthcare providers, or are we, do we practice in the spa environment and provide relaxation massage? And, my short answer to that is yes, we're all of those things and we should embrace them. And that's where a huge opportunity lies, in my opinion, about how massage therapy can contribute to the health of the public, because people are experiencing these health benefits even at the fanciest spa or at a resort in Mexico. You're experiencing stress reduction, maybe help with insomnia, anxiety, depression. It still has all of those same health benefits. And I'm a big believer that, even in the hospital environment, I don't know if you remember this or were aware of this, but I worked with M.K. Brennan and Carolyn Tagg and Beth Rosenthal. You remember Beth Rosenthal from ACAC? Yeah, we did a project on hospital-based massage therapy competencies. And, so what it takes for a massage therapist to practice responsibly and safely in a hospital environment. And interestingly enough, almost none of the competencies had anything to do with hands-on skills or clinical approach. It's
Yeah.
all about the environment and understanding teamwork and communication, how to be a member of a team,
Yeah.
and to practice safely, of course, because these are different types of patients.
Mhm.
But the clinical, and I'll call them clinical outcomes of stress reduction, insomnia, dealing with anxiety and pain. I mean, think about every patient that you've ever seen in a hospital environment. Has any one of them not suffering with multiple with many of those symptoms, regardless of their primary diagnosis? If all we did in the clinical environment, in the hospital environment, was to help manage pain, anxiety, insomnia, uh, uh, which one did I miss? Well, those three, those
Mhm.
three at least. The impact could be huge on
Yeah.
economic, and that's not to take anything away from, the more focused clinical work that I know
Mhm.
you're a legend for focusing on. That stuff is very important too. But the relaxation massage, a simple relaxation massage in the hospital environment, I'm telling you, I believe that's the biggest opportunity.
Yeah.
Uh, oftentimes, we think of and um, we think of massage, or I don't know, I shouldn't say we think of, because I certainly don't, but others often think of massage as this, oh, it's a nice thing. It's almost like a real pleasant experience, but don't really give it that credibility that it deserves,
Yeah.
even for that relaxation type of massage. And I think that's where the gold is.
Yeah. I remember a funny story that Benny Vaughn told me one time about, his difficulty in trying to break into some of the work with the traditional athletic training staff and some of the very high level collegiate and professional athletic groups. And the athletic trainers would be saying things to him like, well, all massage does is make people feel better. It's like, wow, that's an interesting
Right.
concept.
Right. And
Uh,
the way we're not happy about that. I
yeah.
mean, that sounds great. You don't
Yeah.
want that?
Right. And I certainly am in agreement with you that I think there's the potential for making health improvements in virtually any setting that people are in. Some of my cautions and concerns over the years have been more geared around the fact that massage therapists, by the nature of their training and their licensure um, regulations from state to state, basically can do just about anything they want and see anybody that they want. And I don't think personally think in a lot of instances, some people aren't quite prepared when they're working as solo practitioners to make some of those important clinical decisions. And like you said, it's not about the techniques that you're using as much as it is about clinical decision making and like, is this a person who really needs to be referred to
Yeah.
something else, or what is the best, most effective strategy for working with this kind of person? That's where I see a big gap that I
Yeah.
think we still need to do some work on.
I can't disagree with that at all. Absolutely. As a matter of fact, one thing that I've advocated for is massage therapists being, and I mean, I guess I don't really know exactly what sort of policy or whatever I'm advocating for when I say this, but the massage therapist is in such a amazing position to be a contributor to uh, in the hospital environment we've been talking about a little bit, but
Mhm.
also just general screening. So if
Yeah.
we think about the spa environment, there is, I can't think of another, let's call him healthcare practitioner, that sees more of the patient's body, that has more time with the patient,
Mhm.
that touches the patient, client in more spots, right?
Mhm.
And has a relationship with the patient that is trusted. Typically, oftentimes a patient, a client will tell the massage therapist things that they won't tell their physician
Yeah.
that may be important to their diagnosis and their care.
Mhm.
And to your point, that only works if massage therapy education is preparing
Yeah.
massage
Mhm.
therapists to recognize those contraindications, or that mole that's changing size, or a swelling, or a lump that's getting bigger, that sort of thing. I mean, they've got the sensitivity in their fingers. That's the other one I didn't mention. They have all of these tools. The one thing that in some cases, I think you're expressing a little bit of concern about, and I'm agreeing with you, is do they have the education, the knowledge, the experience to at least recognize, when participation in bringing another practitioner into the conversation
Yeah.
would be appropriate and important.
Yeah. So from your putting on your ACIH hat for a moment and your work with these organizations, and also wearing the hat of being extremely well versed in knowing what's going on in the world of massage therapy, what do you see coming down the pike? What can we do in our field to do a better job of, working towards this sort of ideal of integrative care? Like, what kinds of things should massage therapists become more aware of? What kind of organizations should they maybe get involved with or get aware of? What can we do to make those things come closer to that, seeing that
Yeah,
vision, that dream become a reality?
that's a great question. So I got a few thoughts on that. So there's one thing I would say is get involved and show up and
Mhm.
speak up. I mean, just in general, that's really general. But I'll give you a couple examples to show you how that's important. When several years ago when I was at Northwestern and we were advocating for massage therapy licensure at the state level. I remember we were going in and talking with these legislators and explaining to them why it was important. We met with this one representative, and he said, I'm inclined not to vote for massage licensure. I'm inclined not to agree with you on that position, vote against it, because I have a neighbor who is a massage therapist, and she told me that she didn't think it was a good idea, and it would hurt her somehow. And now that's not the influence that we were hoping to have
Yeah, right.
from a massage therapist, but that's sort of beside my point. My point is it can be unbelievably powerful. One conversation that a person can have, whether it's with a legislator or a neighbor or whatever, whoever that is, speak up and talk about the power of massage therapy and what it can do.
Mhm.
The other thing I would say is show up, speak up and show up. And I would encourage folks to learn about, and you're helping us do this today with this podcast, learn about some of these organizations that are representing you and get involved and show up at those conferences and those gatherings
Mhm.
that aren't necessarily just massage therapy focused. I love, people should go to the ABMP gatherings, the school forums, the AMTA National Convention. Show up at those, the massage therapy focused one, but also seek out those groups that are medical doctors that are interested in integrative approaches to care. And oftentimes I shouldn't even say oftentimes, I think in virtually all cases, you would be welcomed. There's a group, for example, it's a chapter of AIHM in Minnesota that meets regularly. Minnesota, what are they? It's their acronym. I don't know that I wrote down their acronym. Minnesota Holistic Medical Practitioners Group or something like that. They meet once every couple of months at Northwestern to share ideas and to network. It's almost all physicians, but what they're talking about is working with massage therapists and acupuncturists and chiropractors, integrative approaches to care. I don't know that there's any massage therapists that show up at those meetings. You know what I mean?
Yeah.
If you were a massage therapist that went to that meeting, that might be more influential and powerful than getting together in our silos and discussing, ideas about how we can reach out.
Mhm.
Do both,
Yeah.
absolutely. I would say, I'm a big believer in the power of relationships. One of the reasons we're sitting here together is because we have a relationship. You know me, we trust each other, that sort of thing. So develop those relationships with anyone that's, practicing in another field and have conversations with them. And if you're interested in working in one of these more integrative environments, oftentimes those relationships are what will springboard you into a conversation about, hey, I might like to work with you on that.
Yeah.
So
Yeah, I would definitely second that and just say, I certainly from my time working with ACAC, just relationships that were built with these people in other professions gave me insights into how things are done in other approaches and other perspectives, different ways of looking things and looking at the idea of whole person care and how do we do the best job, because there is no one treatment approach or modality that is the key thing for everybody, and there's just so many different approaches that and lots of different paths to get us to our final goal, I think, of ideal and optimum health with people. So
I think that's right.
yeah.
The other, one other thing I think that's a huge opportunity for massage therapy is just our approach. Because, maybe because we haven't thought of ourselves and maybe others haven't thought of us, collectively as healthcare practitioners in a very strict sense, our approach to the session is, oftentimes you'll hear a massage therapist say, what would you like me to focus on today, right?
Mm.
And you tell me if it's too much pressure or not enough pressure. That, that's a subtle thing, but it actually is reflective of what's happening a lot in the healthcare industry. So in the VA, they have a whole health program where they're bringing chiropractors, massage therapists, and acupuncturists into the VA system. And a big sort of central kind of tenet of their whole health approach is asking the question, not what's the matter with you, but what matters to you. That's how they approach care of veterans in this whole health process. And it's, kind of trying to get us out of this top-down system of, oh, you have this diagnosis, so here's the treatment, and you must do this because this is what will make you better as we define better. And, we never stop to ask, like, what do you want? And it may be very different than what we assume from the conventional medicine lens of what we're prepared to offer. And I think going back to the massage therapist, what do you want out of today's session? Where do you want me to focus? That's very similar to what matters to you, right? So I think we're already kind of in that mindset of where the rest of the healthcare field seems to be leaning in our approach to patient care.
Sounds almost as if you're really trying to encourage people to be a thinking practitioner.
I like it. I like it. Yeah. Can I use that phrase? Thinking
How about
practitioner?
that? That's the elements behind what we're at, what we're about. So
That's right.
yeah.
I love it. I love it.
So Dale, any sort of closing thoughts of anything that you'd want to leave us with here today for
Oh boy.
thinking about the world of integrative care and soft tissue work?
Yeah, probably 100 things. I know our time is limited, but as you can tell, I'm excited about this stuff, and I could talk about it all day. So, no, I think just encourage those that are listening to participate, speak up, show up, form relationships. You just those connections. You never know where they're going to lead, and your influence on your clients, your patients, the healthcare system can be much bigger than you can even imagine. So
yeah. Well, thank you so much for spending some time with us today. This is, again, like you said, I could sit here and listen to you talk about this for a couple hours and just still get, excited and really just inspired about this. So I want to say a big thank you to you and all the people who have been doing a lot of this work behind the scenes, because there's a lot of people in our field, I think, who get a lot of attention that are, sort of well-known and popular voices and things like that. But there's some people like you who are doing some absolutely incredible work out there that are really shaping a lot of the future of what our work is going to be about. And so I just want to say a big thank you to the unsung heroes like you out there doing some of this kind of stuff. So we're very lucky to have you and very lucky to have your contributions to our field.
thank you for saying that. Yeah, and I think that's a good message also to leave folks with is, there are advocates for our profession that are not massage therapists, but they're advocating for our professions at the highest levels. And we do owe them incredible debt of gratitude for the work that they're doing behind the scenes and such. So yeah, appreciate that.
So, Dale, if people wanted to reach out to you to ask any further questions or get any additional information, is there any place where best places for them to connect with you?
Yeah, I mean, I suppose maybe my email address is probably, if folks wanted to connect with me directly, I'm on LinkedIn, and yeah, DHEALEY at nwhealth.edu. So
Okay, and we'll drop that in the show notes as well. Make sure
yeah,
that's in
sounds
there
great.
as well. And we'll put some links in the show notes to ACIH, AIHM, and some of the other organizations and things that we've been talking about with the alphabet soup that might let people click on those and learn a little bit more about what they're doing as well. So
That sounds great. That
yeah,
sounds great. Thank
all
you
right.
so much, Whitney. Yeah, pleasure
Absolutely.
to visit with you.
Absolutely, Dale. Great to see you again, and thanks so much for joining us here today. So,
You bet.
and if you all remember, Books of Discovery has been a part of the massage therapy and bodywork world for over 25 years. Nearly 3,000 schools around the globe teach with their textbooks, e-textbooks, and digital resources. And Books of Discovery likes to say that learning adventures start here, and they find that same spirit here on the Thinking Practitioner podcast, and they're proud to support our work, knowing that we share the mission of bringing the massage and bodywork community thought-provoking and enlivening content that will advance our profession. So do note that instructors of manual therapy programs can request complimentary copies of Books of Discovery's textbooks to review for use in their programs. Please reach out at booksofdiscovery.com, where listeners can explore their collection of learning resources for anatomy, pathology, kinesiology, physiology, ethics, and business mastery at booksofdiscovery.com. And also note, Thinking Practitioner listeners can save 15% by entering Thinking at checkout. So we would like to say again, thank you to all of our listeners and to all of our sponsors. You can stop by our sites for the video, show notes, transcripts, and any extras. You can find that over on my site at academyofclinicalmassage.com and over on Till's site at advanced-trainings.com. And do note that we would like to hear more from you too with ideas or input about the show, what you'd like to hear more about, or send us any comments or input. You can send us a message or just record a short voice memo or just use traditional email at info@thethinkingpractitioner.com. And you can look for us on social media. You can find Till under his name, Till Luca, and me also under my name, Whitney Lowe, on social media. You can also find us on, as we said, on social media. You can also hop over to our YouTube channel where we put resources for rehabilitative massage over there. Feel free to go check that out. And that's also under my name. And you can also we'd also really appreciate it if you would rate us on Apple Podcasts, Spotify, or wherever else you happen to listen. It does help people find the show. So thanks so much again for listening. Dale, thanks so much again for being with us here today. And we'll see you in the next time.